Hello everyone. I'm Geun-Ho Lee. I'm a professor, Department of Neurology, College of Medicine, Kook University Hospital. Today, I will present my study with the effects of an immersive virtual reality-based intervention to reduce anxiety and depression in medical school students during the COVID-19 pandemic. Results of a randomized controlled trial. Introduction and background. In recent years, no contact and social distancing have become a way of life in the wake of COVID-19. The coronavirus situation has been described as an unprecedented mental health crisis that has spawned the neologism "corona blue" to refer to depression and lethargy. Especially with the prolonged COVID-19 pandemic, many people are experiencing mental health challenges such as loneliness, lethargy, anxiety, and depression. The statistics show that mental health problems such as anxiety and depression continue to rise among adults as the pandemic continues, with young people, especially college students, experiencing the highest levels of anxiety and depression. According to data from the Ministry of Health and Welfare in 2021, depressive syndrome among people in their 20s has more than doubled since the beginning of the pandemic, with 22.5% reporting suicidal thoughts. This suggests that young adults in their 20s are suffering the most from COVID-19. Due to COVID-19, medical college students have had to adapt to the rapid changes in college life and face stressful situations. As all classes were suddenly changed to online, non-contact classes, and this change was prolonged, medical college students complained of many psychological burdens. This is so-called COVID-19 stress syndrome. A wide range of mental health services are being provided across the country to deal with the aftermath of COVID-19, given the severity of these issues. There is a significant lack of empirical research on mental health services for medical students, with only a few studies focusing on the psychological aspects of college students. In this context, new mental health approaches integrating advanced technologies like virtual reality can be crucial. Virtual reality is a computer simulation environment that is very similar to real-world situations and scenarios, giving users a feeling of being there physically. The higher the immersion level, the more realistic the virtual reality experience is for the user. Recent studies have investigated the use of VR for the reduction of stress and anxiety in healthcare workers during the COVID-19 pandemic. Most studies have used non-immersive virtual reality games, so played on flat screen TVs or computer monitors. In contrast, the use of immersive virtual reality-based interventions remains underexplored. Immersive virtual reality uses head-mounted displays. Immersive virtual reality X games have many advantages over non-IVR X games and can offer players more positive gaming experiences compared to non-IVR X games. Experience in immersive virtual reality can lead to greater increases in enjoyment and motivation than X-game play on standard TVs or computer monitors. One of the focal points of immersive virtual reality, particularly when combined with a head-mounted device, is that it improves the discernment of reality in virtual situations. The utilization of HMDs permits clients to feel more inundated within the mimicked environment, which can be advantageous for different applications. This visual limitation can be beneficial in certain settings, such as recovery or treatment. By blocking out the real environment, patients can more effectively drench themselves within the mimicked environment and center on the assignment at hand. This could be especially accommodating for helpful intersessions because of the level of concentration or engagement. Oculus Quest 2 is a virtual reality headset developed by Facebook, now known as Meta. It is the second model in the Oculus Quest series and was released in 2020. Oculus Quest 2 provides higher resolution and improved graphics performance, offering a more immersive virtual reality experience. All-in-one system. Oculus Quest 2 operates as an all-in-one virtual reality system, capable of functioning independently without the need for a PC or external sensors. This enhances portability and convenience. The Quest 2 comes with virtual reality controllers featuring haptic feedback and detection capabilities. Oculus Link allows users to connect the Quest with a PC using a USB cable to access and play PC-based VR content. Objective. This randomized controlled trial aimed to investigate the efficacy and acceptability of an immersive virtual reality training for managing depression and anxiety during the COVID-19 pandemic in a sample of medical students. First, the research questions and hypotheses. First, is immersive virtual reality on head-mounted devices effective in reducing depression and anxiety in the medical students group compared to a control group? Second, is immersive virtual reality game programs using head-mounted devices as effective as conventional virtual reality experiments, which is expensive and has a higher set of costs. Research design. The design of the study was to conduct a 6-week pilot study on the reduction of anxiety and depression levels in medical students to test the feasibility and usability of the immersive virtual reality interventions. The intervention consists of 2 sessions per week for 6 weeks. In each session, Participants will try through an immersive virtual reality standalone system, Oculus Quest 2, followed by a virtual content for relaxation. The subjects of this study were medical students who voluntarily participated in the intervention program for overcoming anxiety and depression due to COVID-19, conducted by Psychological Counseling Center at the University in the South Korea. Total 26 medical students. The program was conducted for 50 minutes per week for a total of 6 sessions. The program's efficacy was evaluated by gauging depression and anxiety levels before and after the program. Participants' eligibility will be verified through a screening interview with the research psychologist who will explain the purpose and the procedures of the training and conduct an assessment to identify participants who can participate in the study. At this time, if the psychologist identifies levels and symptoms of stress and anxiety of clinical interest, the participant will be referred to the institutional psychological help desk and excluded from the study. The inclusion criteria is follows. Current medical school student, maximum age of 35, absence of medical disorders, heart disease, blood pressure, neurological disorders, and epilepsy. Absence of pharmacotherapy that could interfere with the measured data, such as psychoactive drugs, antihypertensives, antidepressants. No significant visual impairment, all with normal visual, corrected to normal visual acuity. Only eligible individuals who provide informed consent will be randomly assigned 1-to-1 to experimental or control. Participants will then be informed of the allocation result. A block randomization procedure using a true random number generator used by the study coordinator to generate the randomized sequence. Both the experimental entry groups consisted of 30 students. Eligible participants received the immersive virtual reality intervention twice weekly for 6 weeks. Approximately 30 minutes of IVR experiences using HMD was scheduled for each session. Participants will try one virtual reality game for about 15 minutes each session. They then use the NatureTrack's virtual relaxation content for approximately 10 minutes. The control group did not receive any training. Oculus Quest 2, the virtual experiences were offered through. It was released in October 2020 and is a standalone headset with an internal Android-based operating system. It is lighter than the first generation Quest and uses a single fast switch LCD panel with this is the games and relaxation programs. The scales used were the Korean version of the Center for Epidemiological Studies Depression Scale and the State Trait Anxiety Inventory, which are self-report measures. The depression scale is a non-diagnostic test developed through epidemiological research on depression in the general public and measures the presence and severity of depression. It consists of a total 20 questions and is rated on a Likert scale from 0 to 3 points. The total score is 60 points. And the higher the score, the higher the level of depression. The state scale consists of the anxiety scale consists of a total of 20 questions and scaled in a record format from 1 to 5, with a higher total score indicating high anxiety. Data analysis was conducted using the SPSS program, and the Cronbach's alpha value for this study was 93, and the Cronbach's alpha value for anxiety was 0.81. The normality of the data was tested using Shapiro-Wilk test. In this study, two-tailed paired two tests were used, in which time was used as the within subject variable if the difference is in the dependent variable between the pre-test and post-test times were normally distributed. In all other cases, the Wilcoxon assigned length test was used. Results: there were no critical contrast in parameters between the resulted and the control subject and the control groups at the baseline. The analysis revealed a statistically significant difference in the depression and the anxiety scores of the 26 college students for pre to the post-test. For the depression test of the IVR treatment group, the post-test was statistically significant, lower than the pre-test. It means that 13 college students who were mentally stressed by depression due to COVID-19 improved their depression after completing the program for overcoming depression. On the other hand, the control group did not show a significant change in depression. The anxiety test also showed a statistically significant decrease from pre to post in the IVR treatment group, which means that the anxiety of the students who experienced psychological distress due to anxiety caused by COVID-19 improved significantly after completing the program. In contrast, the control group did not show a significant in their level of anxiety. The group falsifying interaction significantly, indicating that the improvement in anxiety was more marked in the immersive virtual reality treatment group. The result of this study may provide valuable insights for the development of innovative psychological interventions to help medical students as depression and anxiety have increased since the outbreak of the COVID-19 crisis. As this immersive virtual reality training could substantially reduce depression and anxiety, it may be a viable option to protect the mental health of other college students during and after a pandemic. The proposed immersive virtual reality intervention can be used as part of depression and anxiety management programs for anyone who has been forced into isolation or prolonged hospitalization because of COVID-19 infection or other physical ailments. Limitation: the inability to guarantee that the participants themselves performed the training session or that another person was substituting. The number of test subjects was too small to generalize these results to the entire population. Finally, because the healthcare workers who volunteered to participate may have been more stressed and receptive to a virtual reality intervention, the responses may be susceptible to selection bias. Conclusions. The proposed approach can be implemented quickly and inexpensively as an adjunct or ongoing treatment to enhance the effectiveness of current evidence-based interventions for medical students if the data collected demonstrated the efficacy and acceptability of this immersive virtual reality training for managing depression and anxiety. Furthermore, for other countries of people who need support in managing depression and anxiety, the proposed training could be easily adapted. This is the end of presentation. Thank you very much.